Hello, good evening, and welcome to your favorite medical show, Ask Dr. Saw. As you see, we're in studio, and the man himself is here with us, Dr. Saw. We've been trying to get him in studio for since when? Since last year, Doc. You've been away for a long time. So Doc is here with us in studio, and today we decided we're going to have a little bit more of a different type of conversation, more of an informal gaff, sort of about healthcare, and what Doc would like to see, some of the things he would like to see here in Guyana and so on. We can have a little bit of a discussion with Doc. But man, welcome back. Welcome back.
Thank you. It's nice to be here again. I was looking forward to this actually, and you miss the studio, you miss a bit of a interaction in that way. So yeah, I'm happy to be back.
Indeed. But before we get into the conversation, viewers, as you know, we welcome your questions. We haven't been getting much questions recently, which means that you guys are doing excellent. But you can still ask your question. But before we go into this evening's conversation, Doc, let me ask you these three questions that we had from last week.
Sure.
And remember, viewers, you can continue to send your questions even while we're having a discussion, and we will answer those questions in the following week. So the first question here, and as we dealt with acne
Sure.
last week, the first question here, Doc, is there genital acne?
Yes, I mean you can have acne any part of your body generally, but I said earlier that the areas where you have the pilosebaceous unit, a cluster of it, because the components of acne would be inflammation, infection, you have hyperkeratinization with blockage of the glands, right? So you can have that in the genital area. But it is not so common. What is probably more common in the genital area would be a condition called folliculitis. So now you have hair follicles in your genital, and lots of people shave or they do all sort of, hygiene around that area. And by shaving, the hair follicles can get inflamed. So it presents like acne, where you have pustules and papules. These are boils-like lesion. In Ghana, we call them boils. So you can have boils in the genital area, especially after shaving. Now that can be confused to acne. The mechanism is slightly different. They may have some commonalities. However, that is actually an infection of the hair follicles itself. And usually they're superficial and they can be easily treated. I would advise anyone who's experiencing that, first of all, look at if there was anything you're doing to traumatize the hair follicle. So if you're shaving upward, it causes irritation of the hair follicle, so try to shave in the direction of the hair. And yes, you don't want your blade or your razor, or whatever means you're doing it, to irritate the skin too much. So those are things you bear in mind. There are other lesions of the genital area and the pubic area generally, like herpes, genital herpes. So you would have patients presenting with like ulcers.
Right.
So herpes simplex type 2 is what we call genital herpes. You have herpes simplex type 1, which is the cold sore. So the cold sore lesions, but the giveaway in herpes lesions would be they form vesicles. So vesicles are like fluid-filled lesions.
Right,
so you see as if they are what we in Ghana would say water boils.
When you get born, they call it jalka. The smaller versions of that, right?
Yeah, like a blister.
Yes.
So you're right. So the same cold sore. So you can get multiples of that in the genital. A patient can present like a few days after, where they don't have these vesicles as the fluid-filled lesion, but they burst and they look ulcerated as if, yes, it can be confusing sometimes. Because if you were to see it for the first time and you see it a few days after, you can say, hey, this could be boils or folliculitis or acne type lesion. But you can get acne in areas that have got a pilosebaceous unit.
Okay, great. The next one has to do with diet. But here's the question: what about dal and rice and bhaji? Can that cause acne?
I mean, those are good food.
Yes.
I doubt it. I mean, so when we talk about dal, you've got a lot of protein and carbohydrates in that. Rice. Okay, rice is your carbohydrates. Bhaji, of course, is spinach.
Yes.
Which is lots of vitamins and
Yeah.
So they're good food. I don't know of any evidence. I can't relate that to be the cause of acne. I told you that there are some triggers.
Right.
So food with high glycemic index, we spoke about that. So sugary food, high carbohydrate food, food that allow the sugar to go up rapidly. So these are food that got high content, sugar content. They're associated with acne. But I wouldn't think dal is not that category. That's a low GI food. And of course, bhaji and those things are, vegetables and generally wouldn't cause that. So I don't know of any evidence for that.
Pretty good food too.
Absolutely.
Okay, protein S. What can you use to build protein S? What is protein S, and what can you use to build protein S?
So that's an academic question, really, to be honest,
Okay.
because protein S is not something that I would say clinically relevant in my scope of work, meaning that protein S is a protein produced by the liver. So we call it an anticoagulant protein. So the protein S, protein C, they're responsible for keeping our blood flowing to prevent clots formation. So if you have a protein deficiency, protein S or C deficiency, you have a higher tendency of having clot formation, so blood clots that is. So you have, as we know, you have something called DVT. So that's a blood clot in the leg. Mm-hmm. That is dangerous if it gets into the lungs. Mm-hmm. So if you have protein S or C deficiency, you can have tendencies for blood clots. It is not a condition where you can eat a food and you get more protein S or C. It is not from the food you're eating. It is produced by the body. Now, how do you get a deficiency? You usually get a deficiency from a mutation, a genetic problem. So your body producing it, but there's a coding in the genes that malfunction, and you have a deficiency in it. So that is not a condition that you can eat some food and say health.
Right,
I mean, there are other
right.
components of blood clotting, vitamin K and zinc and some factors that are involved in the clotting system per se. But I don't think, and it's not something that we see very often. It's so rare, I don't know. I mean, you see patients with clots, you look for the more common causes of clots. But yes, of course, we test for that if we can find a cause as such.
Great. So, right, let's have a general discussion then on health and here. Look, you've been away for almost over 2 decades. You were away working in England, I think, right?
Sure. Yeah, of course.
And then you came back here. Obviously, when you came back here, you would have seen where we are. When you left here you were CMO or
well, I was a regional health officer in Region 9.
Uh-huh.
I came back and I work as a GMO. So that's a government medical officer.
Right.
In various departments of Joshua Hospital. So yes, then I went off to specialize in the UK.
Right. So now that you're back here and you've been back and you're more here and you're seeing what's going on and so on. If there's one area in healthcare that you think, well, when I say generally health, human health, that you think more of us should be placing, we should be placing a lot of attention to, what area you think that is? Like, what is this? What are one or two things that you see so common, Guyana?
Absolutely. No, good question. And this is so glaring. I mean, our culture, our lifestyle, and Guyanese as such, we are not so health conscious, in my opinion. Mm-hmm. I mean, I don't think we are so health conscious in terms of, we may very well be, but we allow our way of life to get, well, I would say, like, take the better part of us in terms of, because generally good health, you have to have some restriction in the indulgences. Yeah. And I think we are not too clued up with it as such, or we do not pay much attention to that. We still want to eat our big 3 meals of lots of 3/4 of the plate carbohydrates and that. So if there is an area that need emphasis, would be lifestyle, and that lifestyle in terms of health would influence the common conditions that are affecting us. And what are the common conditions that are affecting us? Diabetes, hypertension, high cholesterol, obesity. If we were to look at those conditions, as a matter of fact, when you look at the causes of death, I tell patients, and I sometimes say this flippantly, that there are only 2 things going to kill us: God forbid if you have an accident or some natural disaster. But the two things that that will eventually kill us would be long gone are the days of infection where we don't die so much from it, at least in Guyana or in the Western world, infection, cancer and cardiovascular disease. Heart disease, cardiovascular disease includes stroke, heart attack,
right.
and those conditions there. Vascular, anything to do with the blood supply.
Yes.
So cardiovascular disease and cancer, they're the two leading causes of death. And if we were, and I say to patients all the time, those are two preventable conditions, totally preventable. And I don't know, maybe I'm a little bit too optimistic, or I say to patients, if I want you to live to 100, I can probably get you close to that. If you were to just follow some guidelines and do the things I say to you to do. And I usually make reference and I make jokes. I'll say, hey, what do you think the royal family live close to 100? They don't have special doctors as far as I know. I know the doctors that are looking after them are UK trained doctors. They're equivalent to all the training that we have had equally. And yes, they will have a doctor assigned to the royal palace, but the fact of the matter is not like some superhuman coming to look at them. But what they do, if you have a complaint, you seek health intervention immediately. There are some things, right? So if you were to say, fine, you've got headaches, and I don't know what's going on, and I'm trying to figure out what's going on in this headache. I'm not going to sit on the headache for 2 years and then see a doctor. I want to know, it may very well be cancer. Shall I not get a scan to see, and sure it is not cancer if the features are not, or at least I'll see a doctor. The doctor will then differentiate, is this migraine headache, is this something, or is this cancer that I'm worried about? And they send you for a scan. So the thing is that proactive nature of healthcare that we need to be, that should be a priority. We spend a lot of time, and this is something I notice here, where we spend a lot of time getting by, making money, looking after kids and family, and we neglect our health. So that's an area. So lifestyle with chronic disease management, and of course we go get involved in health screening. I would say those are my priorities. Right. If I were to say I want to implement a change in our culture, in our society, to get better health outcomes.
Would you encourage somebody who has not done a health checkup for a very long time to go get one done?
Absolutely.
Yeah, because that's one thing that we tend to forget. Now we think that we're not sick because we're not sick. Obviously, we're not sick. So we think that, man, everything is going, but we don't know whether there are small little things, conditions in our bodies that are building up and causing, but we're doing good because we're not seeing the symptoms of it, and all of a sudden we're 50% gone, and then we realize it's gone. So
absolutely. So when you look at disease generally, we have I say to patients, disease, including cancer, is like an iceberg. You have 90% is under the surface.
Right.
10% is what you're seeing.
Mm-hmm.
So by the time you manifest with signs and symptoms, your disease have progressed quite far.
Right.
So you should not, and that's where health screening comes in. You should not wait until you have signs and symptoms. Right. Now I'm seeing blurry, my vision, or I've got pains at the back of my neck, as people say, with high blood pressure, or I have some sort of visual disturbance. You don't wait for that to say my blood pressure is high, if that's the cause. You have your blood pressure checked regularly, so you know, hey, I'm going to pick it up early. Because by the time you get those symptoms, you would have gotten blood pressure for many, many years. You don't wait until you get a heart attack to say, hey, my cholesterol is high, that's what caused the heart attack. Or I have diabetes. You have those checks. In the UK, we do health screening, cardiovascular health screening. It's offered to patients as soon as they turn 40. So anyone over 40, there's some markers. Now, if there is something that I would want to implement, if I were to have a say how things are done, there should be some objective way of how do we get our population to come. Well, one is to get our health professional to comply with, comply in terms of offer these services and record it that has been done. How do I measure? You come to see the doctor, and you see 10 patients, see 10 different doctors. How do I ensure that all those patients are properly managed? Because all the 10 doctors have got different experiences and they've got different competencies.
Right.
And we can't take it for granted because you've seen a doctor, it means that your health is going to be at its best. You may see a urologist, but you're interested in your blood pressure or your heart.
Right.
Well, I don't think, not in any bad way, but I don't think the urologist will be the best man to control your blood pressure or your heart disease. So the point is, we have to have yardsticks and we have to have markers. So what we do in the UK, we have standardized markers. For instance, if you're a diabetic, I want every patient who is diabetic, first, we get you in the register. 2, all those patients, there's some markers we look for. Your blood pressure should be less than 130/80. That got to be recorded in your notes.
Right.
Akash is a diabetic, his blood pressure is less than 130/80. For the normal population, we can accept up to 140/90. That is, top number being 140, bottom number being 90. So let us, for the viewers, to recap, blood pressure, normal that we consider normal, top number between 90 and 140, bottom number between 60 and 90. However, I don't want patients to be at 140/90. Ideally, we want them 130/80. Okay?
Right.
Now, lots of people say, right, I have to be 120/80. No, there's a range. If I shout at you, your blood pressure might go up.
That's right.
If
Yes.
you're calm and you're meditating, your blood pressure will go down. So there are factors. So you have a range of blood pressure. But so simple things like that. You're diabetic, you should have something recording like, I should know what's your blood sugar level. What's the average blood sugar level? It's called the HbA1c. I want your average sugar to be recorded. So if I come to these 10 patients and I say, hey, what's your HbA1c? You'll say mine is 7. I say, okay, acceptable. What is yours? Mine is 10. But both of you been and see the doctor, but somebody accept 10 as a marker and the other person say 7.
Exactly.
So I need to standardize these values. I need to say to patients, for good control of diabetes, I don't want your HbA1c be over 7, for instance. So if your HbA1c is around 7, I'll say, hey, your sugar is well controlled, I'm happy, whatever you're doing, carry on doing that. I want to see every year your record should say, hey, I have had my kidney check done. I've dipped the urine to see if there's protein, because that's the first sign. And they look at these things, they look at these markers. So we got to be guided by the science. The science say if you start having microalbuminuria, that is protein in your urine, that's an increase. That's a marker for heart disease. That's a marker for mortality. You'll die faster than me if I didn't have that.
Right. Right.
So we are guided by the science, and we should have these markers for different conditions. So that is diabetes. Let's say hypertension. Hypertension, I have to have your volume recorded. I have to see that you've had your medication in order. I have to see that your kidney, you don't have changes in your kidney, in the urine, to say that your sugar is badly controlled. I can do a scan of your heart to say that if the pressure is high, your body is pumping against a high pressure, what happened? The muscles get bigger. It's like lifting weights. If I'm working against resistance, the muscle grows.
Right. Exactly.
So if your pressure is high, the heart muscle gets bigger. So there's blood supply to the heart muscle, but if the muscle gets bigger, it outstrips the blood supply. Then you have angina and you have heart attack because there's not enough blood to supply the big muscle.
Right. Right.
Now, these are things we can pick up early. We can do a scan of your heart and say, fine, the muscles look bigger from the scan. I can do an ECG and show that you have enlargement of the muscle, so you can see some of that on the ECG as well. And, there are different conditions. I can name, loads of the chronic disease conditions. People who've had a heart attack, I should ensure that they're on aspirin for life, they're on statin for life. If I find a scan of the heart and the heart is pumping weaker than normal, they should be on a beta blocker. It improves their function, their output. So these are the kind of standardized thing you want. And I think we need to create that in an environment. That's a trajectory where I want Guyana to be. And I think that we want some, standardized markers for us to work on and put some of that in place.
You obviously yeah, we're growing strong, and we're growing at a rapid rate because I don't know if you would have seen 16 regional hospitals.
Yeah,
Diamond Hospital.
yeah,
When I saw the video of the Diamond Hospital, that new Diamond Regional Hospital, man, I couldn't believe what I was seeing. It's like we seem, it's like a first world kind of layout and
Yeah.
and all of that. Does it take much to implement these these standard procedures that you're talking about for us to have that we can implement those things in our system?
Not at all. I don't think so. I think it's a administrative thing that we can implement.
Yeah.
We can have guidance from the health professionals in terms of, okay, let's look at different different conditions, and let us highlight a few markers. We then implement that to all the regions and all the hospitals, and say every doctor who responsible for these patients, ensure that these standardized parameters are met. And then, of course, I don't think what you want to do is to educate the health professionals as to what standards we're looking for, and then you have some check and balances, how they should be implemented and how we should monitor them. So we should have a department of health that can look into that and work along that. And they're achievable. It's easy. It's just compliance with your doctor. I mean, to get doctors on board and do it. So I don't think it is. I mean, I'm quite impressed with the work that is being done in Guyana or going on in Guyana. Of course, the number of regional hospitals are coming up. Indeed, I have seen those social media posting at Diamond Hospital, for instance, and of course it's up to date. It looks well. The technology is there. You have CT scanners. You have all the up-to-date ward with all the monitoring. So yes, so there's nothing holding us back now. I think what is probably and is a human factor, the human capital.
That's right. Yes.
What we need, however, is to engage. I always say, for us to grow, we have to experience. And one of the greatest joy that I've had, really, is the fact that I've traveled. And I've traveled extensively around. And I've interacted with cultures and people and patients generally. And I felt I've learned so much from that. And it opens a different perspective. And when it comes to addressing things like cultural change, it is not something I can dictate for you. I can't say to you, can you stop eating this? No, I have to negotiate with you. I have to show you the wisdom in why you shouldn't eat this and why you should change your diet. And I have to work with you in a slow way. So it takes time to get that cultural shift. And like anything else, everything is an acquired taste. So if I encourage you to eat this leaf, you're not going to eat it. You might say, but you start eating it, you get accustomed to it. But the point is, these are the kind of things you have to do. And I think we are in a good place. We've got, our country is doing well, and economically we are in a better position. And there's nothing stopping us from implementing those changes and getting there.
Right. But on a personal level, I want to ask you this now. Let's say implementing changes and all of that. Can we do, is it something us we can do at home, like set up a little simple chart where we can start monitoring ourselves and, okay, we can't go to the doctor all the time, but can we set up something little at home? What would you advise? And what are some of the things that we should be monitoring? What are some of the things we'd be looking for? Now, that's a broad-based subject because we got so many other things. But let's say we're somebody between the ages of 45 to like 60 in that that range.
So again, let us look at some of the common things. So what I want to monitor. I want to monitor I would tell everyone, have a blood test at least once a year.
Once a year.
All right. So I would just want to say, hey, at least know what your cholesterol level is. All right. If you say my cholesterol is good, fair enough. Carry on doing that. I want to know what's my blood pressure like. My blood pressure is within normal range, and all these things you can Google. So I'm talking simple things you can do at home. I want to know my blood sugar. Is my blood sugar high or is it normal? So if you know that all those things are normal, I want to know that I'm having exercise every week at least. I want 150 minutes of moderate exercise per week. And I want to know that I'm eating healthy, that whatever is good about what I'm doing, so my blood pressure is good, my cholesterol is good, my sugar is good, I want to know that I can sustain that for as long as I can. So I want to ensure that my diet is compliant and I can eat my plate a standardized way. I mean, we can say for practical purposes, 1/3 of your plate carbohydrates. We have a way of where we eat
2/3.
2/3 carbohydrates and 1/3 is the curry.
Yeah.
So I would say 1/3 carbohydrates, 1/3 vegetables, 1/3 protein.
Yeah.
Divide your plate in three and have a meal like that. I mean, there are others in diabetic patients, for instance, we say half vegetable, quarter is your carbs, and your quarter is your protein.
Yeah.
But in for us, of course, I would some people would say culturally, I would say maybe that would be too strict for you at home because you're accustomed to eating 2/3, so I can't expect you to change right away drastically. So I'll say just do it simple. Do your 1/3, do your 1/3, do your 1/3. Now those are simple things you can do at home. Bear in mind, we are talking here physical health. Let us address mental health.
Yes.
Briefly, be aware of your mental health. Be aware of your sleeping habits. Look at things that are bothering you. You may be, overthinking things. You're stressed. You're not sleeping well. It affects your body weight. It affects so many, your relationship, all those things. So be conscious. Do some mindfulness activities. And do that. And so once you can get your physical health on stream, your mental health on board, and your emotional state get a good control. You don't snap and get angry at everything. You're in tune with your body. You're in tune with your physical state, and you're in love. You love the environment. You love people.
Yes,
you love
yes.
relationship.
Yeah.
And that would lead to a joyful life. Why
All
not?
right, yes, of course. I like that. It has to be there has to be some wholesomeness to life.
Totally.
It has to be that. So how long you here here with us for?
A couple of weeks. I mean, my daughter graduation is on the 14th of July.
Oh, so now you do 2 weeks.
So,
Back
so I have
against us
to
now?
head back
Yeah.
for that, and then I'll come back.
So man, we on the show we've been following her and our since last year in the journey. We were when she was going through her exams, we were
Yes,
there and
yes,
so on.
of course.
So I'm happy to know that she has
She's done well.
Yeah, she's done well.
I'm very happy and proud of her. And then she's got a job as well already lined up in August. She started working at Whittington Hospital in London.
What will be her specialty again?
She's not quite sure.
Okay.
So she just finished medical school.
Right.
So they spend 2 years doing what we call foundation years, and then they will choose a specialty.
Okay.
So she's thinking different things. I don't want to influence too much of that. I want her to do something that she enjoys.
I remember when we first met, just for the viewers, so you can actually see this. We got about 2 minutes more to go. You had shared something that was on BBC. It's just like what they have with Jeopardy in America.
Oh yes.
And what's that
that's
playing again?
University Challenge.
University Challenge. And what's her name?
Tayana Saw.
Tayana?
Uh,
Okay, guys, you go to look for it. University Challenge on BBC. Look for Tayana Saw, Dr. Saw's daughter. She was representing,
University College London.
yeah, right on that show. Go check it out, man. I was amazed to see that. If you think Jeopardy is hard, you gotta see that one. That's so hard. Doc, man, it was so good to have you here. As I said, I didn't want to do the regular show today because I'm so happy to have you in studio, just to have a little chat with you. We're gonna be back to regular programming soon.
Sure.
And you're here. I hope that you enjoyed the time that you're here.
No, absolutely.
And England, I know you're gonna go. You're heading back there soon. I gotta come sometime and spend some time with you there, so you can show me a couple of places,
Without a doubt.
and I know you're gonna probably take me for a pint or two. I'm gonna take you up on it.
Yeah, that's the culture. So you have to, of course.
Yes,
you can't go to London without
Yeah.
going to the pub.
That's right. Yeah. The English pubs.
Yeah, but I'm happy Guyana is home for me. I'm happy to be here. I want to be part of the health system where I can contribute to the development and the long-term health progress that we are making. So I'll be here for a little while, and yes, I'm back to do that sort of work.
Yeah, and of course, the show continues even when Dr. Saw is not here. It doesn't matter where he's in.
Correct.
He was in Italy one day. We did the show from there.
Yes.
So wherever Dr. Saw is, we're gonna have the show. We love the interaction that we're getting from you, the general public, and our viewers, and some of us have become family to us here on the show. Continue to send in your messages. Continue to engage with us, and Dr. Saw will be ready to answer your questions on the following week. So again, thank you so much for joining us today. It was different today. We set the different setting. And what you'd like to say in closing, Doc?
Yeah, no, again, I'm excited to be here to be with you guys, and thank you guys for, facilitating this. Yeah, and I know with telemedicine, I don't have to physically be somewhere.
Right.
And as I said, in healthcare generally, I want to empower people to take charge of their health.
Yeah.
You're the one will know when things are bad with you, when things are going wrong with you. And it's just that if I can do health education, for the public to understand what to look out for, what are the dangers, it will go far away. And I don't have to necessarily be here 24/7 to deliver on that.
Right.
And I'm grateful for this platform where I can do that service.
And just to let you know, if you have some medical condition or so that you would like to, like to have some personal something to talk to Dr. Saw about, message me. My number is 652-1314. That's no secret, and I will get you onto Dr. Saw and see how best we can help. About a few persons that has reached out to us through this program already, and it sometimes is just to have clarity from Dr. Saw's perspective as to what's really happening. So again, thank you so much for joining us. It was a wonderful sit down with Dr. Saw this evening, and we look forward for your company next evening. So stay healthy and have a great one, everybody. Thank you so much. Bye-bye.
Thank you. Bye-bye.
Good night.
Good night.